going to demonstrate how we use an AED on an adult casualty. So if you're already doing chest compressions, carry on with chest compressions, don't interrupt. If you're alone, you're going to have to stop to quickly put the AED on. So I'm just going to open the AED, and if you switch it on, it will start telling you what to do.
Open patient's airway. Phone alarm number. If there are no signs of life, remove clothing from chest and stick on electrodes.
Okay, so we put the electrodes are the pads here. So it tells you where they go.
Stick electrodes on the patient's bare chest.
So the right one is gone on the right side of the chest, and the left one is gone just underneath the left armpit.
Stick electrodes on the patient's bare chest.
So the heart is in between the electrodes, and if you're already doing chest compressions, carry on.
Stick electrodes on the patient's bare chest.
And wait for instructions.
Do not touch the patient from now on. Analyzing heart rhythm.
So you want to stand away, at least a meter away. Everyone should step back. If you have any oxygen, remove it, because you've got live electricity coming from the AED and going through the person, through the pads that you have attached on the chest and underneath the armpit on the other side.
Shock not advised. Patient may be touched. Carry on resuscitation. Alternately, give 30 chest compressions and 2 mouth-to-mouth breaths.
So you carry on your chest compressions now. It even gives you a rhythm to follow. So it's how fast you have to go, how deep you have to go. So remember your 5 to 6
Now give 2 mouth-to-mouth breaths.
Okay, so if shock is advised, it tells you that the shock is advised. In the scenario that we've just done, the shock was not advised. But in any case anyway, even after you press the shock button, it tells you to come back. You don't stop your chest compressions, you carry on with your chest compressions. Then you go through another cycle of doing chest compressions, and it will tell you again to stop after 2 minutes so that it can analyze the heart rhythm. The key there, obviously, the reason why we want to know what the heart rhythm is that if it's VF, ventricular fibrillation, or VT, pulseless ventricular tachycardia, the heart is going so fast, it does not sustain life. There's no blood being pumped to the brain, and there's no oxygen going to the brain and the rest of the body. So the idea of the AED is to shock the person and stop that heart rhythm. So you are practically stopping the heart from working. And once it's stopped from working, what you hope now is that it can restart and blood can start flowing back to the brain and the rest of the body and carry the oxygen with you. So really simple to use piece of equipment. Switch it on, follow the instructions, put the pads, one on the right side of the chest, the other one just underneath the left armpit. The heart is in between. If it's a shockable rhythm, it tells you to shock. Then the flashing button flashes and you press that to shock the person. If it's not shockable, it will tell you that no shock is advised and you need to carry on with the chest compressions to 2 rescue breaths. And after 2 minutes, it will stop again to analyze. And then again, you stand back, remove oxygen or any other things that might be there. And hopefully you can get the person back.